If you're over 60 and you've been taking cholesterol medication for years, this might be one of the most important conversations you'll hear today. Because what I'm about to explain is not meant to scare you. It's meant to help you understand something most people are never told. Many of my patients come to me with the same story. They've been doing everything right, taking their medication on time, following their doctor's advice, going to regular checkups, and yet something still feels off. They feel more tired than before. Their energy isn't the same. Sometimes they notice subtle changes in their body, but they can't quite explain it. So they ignore it. Because after all, this is the medication that's supposed to protect them. But here's what most people don't realize. As we get older, our body doesn't process medications the same way it used to. What worked safely at 45 doesn't always work the same at 65. And in some cases, certain cholesterol medications, especially when taken long-term, may begin to place extra stress on one very important organ, your liver. Now let me be very clear. This doesn't mean the medication is bad, and it doesn't mean you should stop taking anything on your own. But it does mean you deserve to understand what could be happening inside your body. Because in many seniors, the early signs of liver strain are very subtle. They don't show up as pain. They don't feel urgent. They show up quietly. And that's exactly why they're often missed. In this video, I'm going to walk you through what these medications actually do over time, the signs your body might already be giving you, and the simple steps you can take to protect your health, without putting yourself at risk. Because the goal isn't fear. The goal is awareness. And once you understand what's really happening, you can start making better, safer decisions for your future. Before we talk about the risks, we need to understand something very important. Why are you taking cholesterol medication in the first place? Because for most people over 60, the goal is simple. Reduce the risk of heart attack, prevent stroke, keep blood vessels healthy. And for many patients, these medications, especially statins, have done exactly that. They lower bad cholesterol, known as LDL, by slowing down how much cholesterol your liver produces. On paper, this sounds like a very good thing, and in many cases, it is. But here's the part that often gets overlooked. The same organ responsible for controlling your cholesterol is also the organ responsible for processing the medication. That organ is your liver. Every single dose you take doesn't just disappear after doing its job. It has to be processed, filtered, and managed by your liver. And when this continues for years, sometimes decades, your liver is working constantly in the background, without you ever feeling it. Now here's where things begin to change. As we age, our liver doesn't process substances as efficiently as it once did. This is a natural part of aging. At 40, your body might handle medications quickly and smoothly, but after 60, the same dose can stay in your system longer. That doesn't mean something is wrong. It simply means your body is different now. And that difference matters. Because over time, certain medications may begin to create what we call low-level stress on the liver. Not damage you can feel immediately. Not something that sends you to the hospital overnight. But something gradual, something quiet, and something easy to miss. Many seniors don't notice anything unusual at first. There's no sharp pain, no sudden warning sign. Instead, the signals, if they appear, are subtle. You might feel more fatigued than usual, even after a full night's rest. You might notice your appetite isn't what it used to be. Some people describe a general feeling of heaviness or discomfort, but they can't point to a specific cause. And because these changes happen slowly, they're often blamed on aging itself. I'm just getting older. This is normal at my age. But sometimes, your body is trying to tell you something more. Now, let's be very clear again. This does not mean you should stop your medication. That would be unsafe. Cholesterol medication can be life-saving for many people. But what it does mean is this. The same medication that protects your heart may require a closer look as your body changes with age. Because health after 60 isn't just about continuing what worked before. It's about adjusting, monitoring, and understanding. In fact, one of the most important things many seniors are not told is that routine blood tests, especially liver function tests, become even more important the longer you stay on these medications. These tests don't just measure numbers. They give you a window into how your body is responding. And in many cases, small changes can be managed early, before they turn into bigger concerns. The problem is, most people don't ask, and most doctors don't always explain it unless there's a reason. So the cycle continues. Prescription renewed, medication continued, questions unasked, and everything seems fine until it isn't. That's why awareness matters, because when you understand what your body is going through, you're no longer just following instructions, you're actively protecting your health. In the next part, we're going to talk about something even more important, the specific warning signs your liver may already be giving you and how to recognize them early, before they become serious. Because once you know what to look for, you'll never ignore those small signals again. Now that you understand how cholesterol medication is processed in the body, the next step is recognizing what your body might already be telling you. Because in many cases, your liver does not suddenly fail or send strong signals right away. It communicates slowly, quietly, and often in ways that are easy to ignore. That is what makes this part so important. Most people expect a serious problem to come with obvious symptoms: pain, sharp discomfort, something that clearly feels wrong. But the liver does not work like that. It is one of the most resilient organs in your body. It continues to function even under stress, often without showing clear signs until that stress has been present for a long time. And that means the early warning signs are usually very subtle. One of the first changes many seniors report is ongoing fatigue. Not the kind of tiredness that goes away with rest, but a persistent low energy that stays throughout the day. You wake up but you do not feel refreshed. Simple tasks feel heavier than they used to. This happens because the liver plays a key role in energy regulation. When it is under strain, your body may not process nutrients as efficiently, leading to that constant feeling of low energy. Another common sign is a reduced appetite. You may not feel hungry at your usual times, or food may not feel as appealing. Some people notice they start skipping meals without really thinking about it. Again, this is easy to overlook. Many assume it is just part of getting older. But changes in appetite can sometimes reflect how your body is processing what you consume. There is also a subtle digestive discomfort that some people experience. Not severe pain, but a mild heaviness, especially after eating. A feeling that your system is slower than it used to be. It may come and go, and because it is not intense, it is often ignored. Another sign that often goes unnoticed is changes in how your body handles medications in general. You might find that you feel slightly different after taking your usual dose, maybe a bit more sensitive, or slower to recover from side effects that never used to bother you before. This is because your body's ability to process substances changes with age, and the liver plays a central role in that process. Some individuals also notice changes in their skin or overall appearance. This does not mean anything dramatic, but things like a duller complexion, or feeling like your skin is not as vibrant as it used to be. These changes are not always directly linked, but they can sometimes reflect internal shifts in how your body is functioning. One of the most important things to understand is that these signs rarely appear all at once. They come gradually, one small change at a time. And because each change seems minor on its own, it becomes easy to dismiss them. You tell yourself it is normal. You tell yourself it will pass. And in many cases, people continue their routine without giving it a second thought. But when you step back and look at the pattern, you begin to see something different. It is not about one symptom. It is about the combination of small signals. That is where awareness becomes powerful. Because once you recognize that these subtle changes could be connected, you can take action early. Not by stopping your medication, but by asking the right questions. By discussing these changes with your doctor. By requesting routine monitoring, especially liver function tests. These tests are simple, but they provide valuable information. They help you understand whether your liver is handling everything well or if adjustments might be needed. And in many cases, small adjustments can make a significant difference. It could be a change in dosage, a different timing of medication, or simply closer monitoring over time. The key point here is not fear, it is attention. Because your body rarely stays silent. It speaks, just not in ways most people expect. And when you learn how to listen, you give yourself an advantage that many people never have. In the next part, we are going to talk about what you can actually do. Not just what to watch for, but practical steps you can take to support your liver while continuing to manage your cholesterol safely. Because the goal is not to stop treatment. The goal is to make sure your treatment is working for you, not against you. Now that you understand the possible warning signs, the next question becomes even more important. What can you actually do about it? Because the goal here is not to stop your medication. For many seniors, cholesterol medication plays a critical role in preventing serious conditions like heart attacks and strokes. Stopping suddenly, without medical guidance, can do far more harm than good. The real goal is balance. It is about continuing what protects you, while also protecting the parts of your body that are working harder behind the scenes. And the first step in that process is simple, but often overlooked. You need to start asking better questions. Many people take the same prescription for years without ever revisiting it. It becomes routine, automatic, something you trust without thinking. But after 60, your body is not the same as it was before. That means your treatment plan should not remain static either. A simple conversation with your doctor can make a significant difference. Ask whether your current dosage is still appropriate for your age and condition. Ask if your liver function has been monitored recently. Ask if there are alternative options that may be easier on your body over time. These are not difficult questions, but they are powerful ones, because they shift you from being passive in your care to being actively involved in it. The second step is regular monitoring. If you have been on cholesterol medication for a long time, routine liver function tests become extremely important. These tests are not something to fear. They are a tool. They allow you to see what is happening inside your body before you can feel it. In many cases, changes in liver enzymes can be detected early, and when something is caught early, it is much easier to manage. This is how small issues stay small. The third step is supporting your liver through your daily habits. Your liver is constantly processing everything you consume. That includes medications, food, and even environmental toxins. So the less unnecessary burden you place on it, the better it can function. One of the simplest ways to do this is by paying attention to what you eat. A balanced diet that includes natural, whole foods can help support your liver's function. Fresh vegetables, fruits, and foods that are not heavily processed allow your body to work more efficiently. On the other hand, excessive intake of processed foods, added sugars, and unhealthy fats can increase the workload on your liver. Hydration is another key factor. Water plays a major role in helping your body process and eliminate substances. Staying properly hydrated supports not just your liver, but your entire system. Another important area is alcohol consumption. Even moderate alcohol use can place additional strain on the liver, especially when combined with long-term medication use. For many seniors, reducing or avoiding alcohol altogether can significantly lower that extra burden. You should also be mindful of combining multiple medications or supplements without guidance. Some over-the-counter products, herbal supplements, or even common pain relievers are also processed by the liver. When combined with cholesterol medication, they can increase the overall load on your system. This does not mean you should avoid everything. It simply means you should be aware and consult your doctor before adding anything new. Another step that is often underestimated is consistency and routine. Taking your medication exactly as prescribed, at the correct time, helps your body process it more efficiently. Irregular timing or missed doses followed by doubling up can create unnecessary stress on your system. Consistency supports stability, and stability supports your body's ability to adapt. Finally, it is important to listen to your body without overreacting. There is a difference between awareness and anxiety. You are not looking for problems. You are simply paying attention. If something feels different, if you notice changes that persist, it is worth bringing them up in a calm and informed way. Most of the time, these situations can be managed with small adjustments. And that is the key takeaway here. You are not powerless. You do not have to choose between protecting your heart and protecting your liver. With the right awareness, the right monitoring, and the right conversations, you can do both. In the next part, we will look at something many people never consider: why some seniors continue taking the same medication for years without any review, and what that could mean for your long-term health. Now that you understand how these medications work, the warning signs to watch for, and the steps you can take to protect your liver, there is one final question we need to address. Why does this continue for so many people, for so many years, without change? The answer is not as complicated as you might think. For most patients, cholesterol medication begins with a clear purpose. A diagnosis is made, a risk is identified, a prescription is given, and in the beginning, everything makes sense. The numbers improve, cholesterol levels come down, the treatment appears to be working, so the prescription is renewed, and then renewed again. Over time, it becomes part of your routine, something automatic, something expected. But here is what often gets missed. The original decision to start the medication was based on a specific moment in time, your health, your body, your risk factors at that point. Years later, those factors may not be exactly the same. Your body changes, your metabolism slows, your liver processes things differently. But the prescription often stays exactly as it was. Not because anyone is doing something wrong, but because the system is designed for continuation, not constant reevaluation. Doctors are managing many patients, appointments are limited, and unless something clearly goes wrong, the default approach is to maintain what seems to be working. From the outside, everything looks stable, but stability on the surface does not always reflect what is happening underneath. This is why so many seniors continue the same medication for years without ever asking if it is still the best option for them. And this is where your role becomes essential. Because your health is not meant to be managed on autopilot. It requires attention. It requires awareness. And sometimes it requires you to pause and ask a simple but powerful question. Is this still right for me? That question alone can change everything. It does not challenge your doctor. It does not create conflict. It simply opens a conversation about your current health, your current needs, and whether your treatment still fits your body as it is today. In many cases, the answer will be yes, and that is good. It means the medication is still doing exactly what it should. But in some cases, small adjustments may be needed. A lower dose, a different type of medication, more frequent monitoring, or simply a closer look at how your body is responding over time. These are not drastic changes. They are thoughtful ones, and they can make a meaningful difference in how you feel and how your body functions. There is also something else that is important to understand. Many people believe that once they start a medication, it becomes permanent, that it is something they must take forever, without question. But that is not always the case. Treatment should evolve with you. As your body changes, your plan should adapt. And that does not happen automatically. It happens when you stay engaged in your own care, when you ask questions, when you pay attention, when you choose not to ignore the small signals your body may be giving you. Because those small signals are often the earliest indicators that something needs to be reviewed. Not feared, not ignored. Reviewed. That is the difference. And that is where long-term health is protected. Not just by medication, but by understanding, by balance, and by being involved in the decisions that affect your body. At the end of the day, cholesterol medication is not the enemy. For many people, it is a necessary and helpful tool. But like any tool, it needs to be used correctly, monitored carefully, and adjusted when needed. You do not have to choose between protecting your heart and protecting your liver. With the right approach, you can do both, and that is the message you should take with you. Not fear, not doubt, but awareness. Because when you understand what your body needs, you are no longer just following a prescription. You are making informed decisions, and that is what truly protects your health over time.